Finding Meaning After Cancer. So we'll just jump in if that's okay with you all. So as we're really just being clear with each other, that there is a huge number and growing numbers of survivors of cancer. In the US, it's 18.5 million, and in, of course, the EU, it's 23.7 million. But really, it's not just the survivors and just not the fact that so many are being diagnosed each year, but that actually it's not about, living just longer. It's living better. And we're really looking at this conversation today as understanding the depth and experience, particularly for you who are dealing with and facing on a long-term basis myeloma. And this is, by the very nature of the disease itself, there's complexity. And there is growing complexity because of just what goes on as medicine evolves. There are so many more tools that exist, so many other treatment choices, which adds to the burden. The last thing we want is decisional regret. And yet we're asked to make decisions. And we're in situations where there is recurrence and relapse, especially in myeloma. And that adds its own burden, rinse and repeat quality to it. And so there are just more needs and there are more services, and we cannot forget the financial burden and challenges associated with this. So in that backdrop, we understand more deeply than we can imagine. And I think the Myeloma Patient Support of Europe in particular understands this deeply, that it's not just about your physical well-being, it really is about the mental and emotional well-being. And this must include psychosocial support, and your organization is at the heart of that. So let's understand so we have a common language. And you can raise your hand if I'm not clear, but I know we're recording, so we'll be mindful of that as well. But we really anchor all of our conversations about emotional and psychological support around the sixth vital sign called distress. It's common, it's ubiquitous, and it really describes the unpleasant emotions associated with the diagnosis and treatment of cancer. It's not just cognitive, it's not just behavioral, it's social, emotional, and spiritual. And it interferes with our ability to cope. And actually nearly 50% of patients experience this distress that's almost equal to a diagnosis of a mental disorder. And emotional distress, truthfully, is underreported and is by far the most common side effect of cancer. So what does that really look like? And for many of you, this is going to be preaching to the choir, but it's meant to validate in a profoundly deep way your experience so that you are actually not alone. So it's a range of feelings: sadness, fearfulness, anger, despair, depression, and particularly this sense of anxiety, this anticipatory anxiety that so many have talked about. It's in this experience of recurrence, remission, there is this anticipatory anxiety that you all live with. It's like, when will the other shoe drop? And in our nervous systems, it has an effect, and I'll really talk more about it. So we understand the reliable symptoms, and we're using reliable as kind of predictable. There's persistent depression or lack of pleasure in activities. But unreliable symptoms really refers to this place in ourselves, and in particularly the diagnosis of myeloma with fatigue as the persistent side effect, the persistent nature of exhaustion. And we're describing fatigue in this way is not like, oh, I need a nap, right? The fatigue that we're talking about here is the fatigue that rest doesn't alleviate the fatigue. That's a different level in our bodies and our nervous systems because it's a blood disorder. We understand the complexities of treatments and the risks of treatment, and you live with this. And so it creates, we use the word insomnia, but our ability to actually experience restful sleep, our experience of actually enjoying the things that we are doing are impacted. We understand decreased libido, but it's intimacy and sexuality aren't just about intimacy and sexuality, it's about relationships and the connections with each other. And these symptoms impact us. You don't need me to say it. We're just validating what you know and underscoring it. And what I want to kind of stay with this one for a moment, all of those symptoms, long-term unremitting stress affects the immune system, our entire nervous system. So for time to time, I like this really comic strip from Peanuts. We just got our test back. I hate to look. They say that a D- can impair the function of our immune system and disrupt our chemical balance in our bodies. I hope I didn't get a D-. Sorry, body. We know that all of the effects of what we're doing has an emotional effect on us and affects our immune function. So here's the heart of the matter, and I think what we're really trying to stay with today, that cancer actually is a multiple traumatic event. There is and we're understanding, maybe we should be clear, how are we defining traumatic? Trauma is defined as real or perceived threat to our lives, real or perceived, right? And living with myeloma in particular, it has that quality to it. So there's the diagnosis, right? There is the shock of that diagnosis, the impact of what you're asking your body and yourselves to go through and your family to go through. There are the treatments themselves, right? There's the side effects of treatment, and there's effects on loved ones and family members. And by the way, nearly 50% of caregivers have equal or greater distress than those patients themselves. So the caregiver burden is huge and it affects all of us, let alone financial toxicity, the cost of care, and then the impact of returning to work and the experience of being off work for so long for many, and then returning. And how does that become navigated? These are all of the multiple traumatic aspects of a diagnosis and treatment of cancer. So that kind of changes the way we think about, oh, there, you're going to be fine, you're going through treatment. No. This is impactful. And treatment goes on for not days or hours or weeks, but months, if not years. So are we understanding each other in a deep way, what you are actually asking yourself to experience as we're going through this, the diagnosis and treatment. But what have we learned from you? So this is a bit of the good news and also a strategy to go forward. And really, it's important to realize that as clinicians and researchers, we are learning from you. You are our teachers. So first and foremost, the value of support groups. Why? Why are support groups so helpful for not just patients with myeloma, but for patients globally? So this is what we've learned from you. This is based upon 8 years I spent along the way doing research at Stanford. And I should really qualify. It's not fair to say it that way. I spent 1 week a month for 8 years doing a series of 5 research studies with the team at Stanford to really find out what it is that really makes a difference in support groups. So I'm grateful for that opportunity, and I'm really happy to be able to share some of this with you. First and foremost, why folks join a support group is to be with others who understand what they are going through, what you are going through. It's really critical to not feel so alone. Just being with others makes a difference. The second thing that happens in support groups, in this information exchange, we develop a better partnership and relationship with doctors and our healthcare teams. We learn strategies from each other. We learn, creative solutions. We learn workarounds. And we tell each other the stories, and we listen to each other, because then we can make changes in our lives that are important to ourselves, because we see it with the folks around us. There's no other person a person with cancer wants to see than another cancer survivor. And in that way, you develop a new attitude towards the illness. You become much more strategic. You begin to look at what makes a difference in your life, because then you're able to better access cancer-related resources and information, like being here today, just like being here today. So, what are the three stressors that support groups help alleviate? I mean, the first one kind of like makes sense, right? Unwanted, and this is data driven, so I'm not making this up. Unwanted aloneness, loss of control, because we begin to get strategies to figure out what to do. And it addresses loss of hope, that you're with others who are finding ways of coping. So what are the lessons that we start with? We all breathe. We all breathe. But when we think about cancer as a multiple traumatic event, what we think about is breathing in a very specific way. And that breathing is very similar to the breathing of any of us who've done any exercise or walking or done yoga. It is breathing in a very specific way. We breathe in and out through our noses. And that breath goes down our throats and goes to the bottom of our chest, the diaphragm muscle, and it fills up like a water balloon. It's breathing in and breathing out. And we can even do it this moment in silence, just as I'm speaking, as we're looking at this scene from South Vietnam, as our ship was coming into port. And we have a chance, even in this moment, to receive the benefits in our nervous system by breathing. And this is important. It helps calm our nervous system by breathing in this manner. And this is actually medication. So support groups, providing ways of reducing unwanted aloneness, loss of control, and loss of hope, and breathing in this manner are treatments for anxiety and depression, and helps our immune function. Second, we learn to express emotions. And every culture and community is different, and I'm not selling expressing emotions. I'm introducing you to the possibility that emotional expression has value in regulating the uncertainty and anxiety that you all face on a daily basis and from time to time. But what emotions? What are we talking about here? So that as a result of that work at Stanford, we were looking at, well, which emotions, when expressed in support groups, deal with better health outcomes? That seems like a pretty good question. And so we learned, and the way we did this is in the study we did, we videotaped support groups for several years. And we took that data and looked at what effect of expressing emotions and which emotions had a beneficial effect on health outcomes. Not cure health outcomes, reducing anxiety, depression. When you reduce anxiety and depression, what happens? You're more able to tolerate treatments. You're more able to listen to information your doctor is sharing with you. You're able to talk better to your family. So the emotions we're talking about. So I know this is going to sound technical. Primary negative affect, expressing fear, anger, and sadness in a supportive environment is helpful. That's the value of a support group. I'll say it again. Expressing fear, anger, and sadness in a supportive environment where others can listen is regulating our bodies, is calming. It allows us to feel a little bit less alone. So the big idea here is, okay, well, if expressing emotions is good, what's the opposite? Suppressing those emotions, fear, anger, and sadness. We're more likely to be angry. Suppressing anger, we're more likely to be more angry and hostile. When we suppress fear, we become more closely connected to, panic attacks. When we suppress our sadness, we're more likely to become depressed. So there is this relationship of safely expressing emotions that support groups particularly provide. So let's take a breath. I know we're talking a lot of different levels. I'm sure you're going to have questions. So we're just going to take a moment and hold all that. Expressing emotions has a positive effect on health and well-being because you're able to stay connected to people. You're less angry. You're more able to get support for yourselves. So here's one more that comes up so often in families, and I'll read this if you can't really see it. Hey, why are you sitting in here all gloomy and lonesome? Let's stoke a fire, turn on the lights, and play some tunes. A good cry is hard to find. Sometimes we just need to allow space for our emotional expression. And I'm just going to take a moment around this one because I think there's really something interesting here. Our loved ones, our families want to be helpful. And sometimes you may say to your loved one, oh, I'm anxious about going to the doctor tomorrow. And your loved one will respond, oh, you'll be fine. It'll be okay. The loved one's intention, of course, is to be supportive and helpful. But for you as the cancer patient and survivor, that is experienced as what we call a constraint on disclosure. It's meant to, oh, I'm done talking about this. I want to move on. So we have these disconnects that occur. We have the sense that our loved ones want to help, and at sometimes some kind of help just doesn't work. That's the value of having support, where we can work this out for both you as the cancer survivor, but also your family members, because it affects the whole family. The unit of care should be the entire family. Okay, so finding humor. Okay, what do we mean? There was supposed to be a photo there. There's the phone. There's the photo. Finding humor. What happens in support groups, I've had the privilege of doing about 15,000 support groups in my time at the cancer support community. And, I'll tell one story just because we're together. And one of the stories was when I was doing one of these groups, one of the survivors, a lung cancer survivor in the group, came into the group and really excited. And he's come in and throws on the coffee table in the middle of the room a contract that he just signed for a new car. And he's leasing the car. And the car is, it's a kind of a mini sports car. Not fancy, but a sports car. And he was all excited. And he said, oh, the dealers asked me this question. Well, how many years of a lease do you want? And he said, well, how long does it go? Well, up to 7 years. I want the 7-year lease. And so we have in these groups so often gallows humor where we understand, you know, we're dealing with a life-threatening illness, but we have ways of laughing. And this is a scene in North Vietnam, actually, where we were trying to figure out how do we going to wipe our hands after using a porta potty. So that's my wife and two cousins. So if I'm going to go back too, because I don't, so it's really being with family and friends was that one as well, but it's also the humor. And really being with family and friends is part of support and support groups, being supportive of each other, because you become like extended family. So use hopeful words. Well, what does that mean? So the example that I was taught by you is um, often we hear patients, and this is what I was taught, hear themselves say, "Oh, my cancer." And one patient said to the other patient, "Do you really want to think of it as yours? Why don't we think of it as the cancer, as something separate from us? And that we're looking for ways that we pay attention to our language. We think about ways to support ourselves in our efforts. Hopeful words isn't about just rah rah. It's about, I am going to do everything I can to be there for my family and my children. I know these treatments are difficult, but you are important to me. There's language that we can use that remind ourselves that there is purpose, there is meaning, that you're not just a myeloma with you, but it's you with myeloma. You are a person. You have relationships, and it matters. So the other thing is to make plans for the future. As I like to say it, it's making plans for the future means that there's a future in your future. And so I want you to consider whatever you do about planning a dinner, planning a trip, it's a treatment, right? It's a treatment on the emotional and psychological distress level. Treatment, making plans for the future. One of the members in our group would make a joke like, I joined this group and I thought I was going to deal with cancer. Now I'm making plans for where my next vacation is. This is a travel agency. You can think of it that way, but think of it as treatment, not just I'm going on vacation. This is medication, being in settings that are beautiful or with others who you care about. About a decade ago, I had the privilege of hiking Kilimanjaro, and that's the scene from the top as the moon is descending and the sun is rising. And so all of us have this idea, not necessarily about Kilimanjaro, but, you know, we're all going to the mountain. We just don't know when. So here are some bonus skills that others have taught me. Give and receive compliments. How did that come up? Well, it's noticing and what it feels like when others see you. Noticing that's a lovely blouse. What a beautiful smile. Gosh, that pin or brooch is beautiful. And what happens, people smile back at you. They connect. When you express your fears, I'm going to oversimplify it for sure, but if you express the fear, I don't know how I'm going to get to treatment tomorrow. When you express it, then people come up with ideas and solutions. Oh, you can do this, you can do that. and develop an inner supportive voice, the voice that says, at a girl, at a guy, go for it. Encouraging words, and continue to look for meaning and purpose in everyday life. And I'm going to underscore a way of breathing is essential. It helps reset our nervous systems. So, as Norman Cousins, kind of the father of how we think about, one of the fathers, I should say, of how we think about, survivorship. You don't have to deny the illness to defy the prognosis. You can be active participants in your own recovery through the ways we've just outlined today. So thank you. You don't need eyes to see, you need vision. And I hope we provided a little bit of a pathway for you to all to think about going forward. So thank you for the opportunity to share, and I look forward to your thoughts or feedback or questions.